I just got a phone call that I need to go to room 213 to help with manually ventilate Mrs. Smith. She is an 83-year-old woman with no facial or spinal injuries, but stopped breathing. So on my way there, I'm going to go ahead and gather my supplies. I'm going to grab an Ambu bag and some different oral pharyngeal airways, and I'm going to go ahead and go to the room. So upon entering, I'm going to knock on the door. Kate with respiratory, and the patient's not responsive. The nurses are working on her, so I'm just going to go ahead, put some hand sanitizer on, put on some gloves, and assess and see what kind of oral pharyngeal airway will best fit Mrs. Smith here. We're going to go with this one because it goes from the tip of her mouth all the way to the tip of her ear. I don't see any chest rises. I'm just going to listen to see if I hear any breath sounds at all. And she is not moving any air. So I'm going to go ahead and insert this, do a chin tilt here, and insert the oral pharyngeal airway. It's going to go in upside down, pressing back on the tongue. Halfway, we're going to do a 180-degree twist. And now the flange is sitting right on her lips, opening up that airway so I can administer breath. I'll go ahead and put my Ambu bag up to the oxygen tank and secure the mask around her nose and mouth, and keeping that chin tilt up. I'm going to administer breaths, 12 to 20 breaths per minute. What I'm looking for is chest rises for Mrs. Smith here. I'm going to be monitoring her SpO2 and seeing if she has any spontaneous breaths in between. And if she does, I'm going to try to administer the oxygen while she's breathing. I want to make sure that the bag is refilling itself here, so we have the maximum FiO2 possible to Mrs. Smith. The oxygen tank is hooked up to the bed, so if we need to go to the OR or anywhere, we are ready to go, and I'm mobile, and I can do this all the way until further whatever we need to do for Mrs. Smith, if she needs to be intubated, trached, or what needs to be done. So.